Okay, so walk in, the scene is safe. I'm wearing the appropriate PPE, which is gloves and glasses. I notice that we have an infant which is sitting on top of their parent's lap. So it's best to keep them like that so that they're not stressed or get anxious at all if they can. So a PAD assessment is a quick hands-off approach assessment that's generally done from across the room so that my presence doesn't further distress or make the child anxious. There are three components with the PAD assessment. The first one is appearance. So obviously you can assess the patient so the ABPU, the patient is alert. Appearance. Now, appearance provides information about the perfusion of the brain, so following the mnemonic tickles can help you focus on key aspects of the patient's appearance. So T is tone, so is the patient floppy, listless, are they holding themselves, moving spontaneously? So this patient is sitting upright, he's not floppy, and he's moving spontaneously. Interactiveness. So does the child respond to people, sounds, or are they uninterested? So the patient is looking at me, seems interested in what's going on around them. Consolability, so can they be consoled by their parents? So at the moment this patient isn't crying, but let's just say the patient is crying. The parent just, gives a little bit of a, it's okay, and then they quieten down. Look gaze, so does the child make eye contact, or are they glassy-eyed or look away in the distance? So the child is maintaining eye contact. Speech cry, is the speech strong, cry strong or weak, muffled or hoarse? The next component is work of breathing, so which is a good indicator of the adequacy of oxygenation and ventilation. So it's important to listen for any abnormal airway sounds and look for signs of increased work of breathing. So you want to look for, or listen for, snoring, muffled hoarse speech, stridor, grunting or wheezing. Any abnormal positioning, so sniffing the air position for children who can sit. So they may find that if their heads up they can breathe a lot better, or if they're in the tripod position, or if they're refusing to lay down. You also want to look for any sort of recession, so in infants, head bobbing, recession of the chest muscles, the supraclavicular retraction, and also the tracheal tug, and as well in babies, nasal flaring. The last component is circulation to the skin, so which notifies us to reduce cardiac output, so whether the patient is white or pale. So you can see that the patient is quite well perfused, a nice pink colour, but you also want to look out for cyanosis, so blue discoloration which around the lips or on the skin, or mottling of the skin. So just with the mottling of the skin, just is the child cold, which may alleviate that. Once that quick PAT assessment is done, you then go into your primary survey. That should PAT assessment should notify you of any life-threatening things that need to be dealt with straight away.